Good afternoon everyone. My name is Dolsy Sharma. I am working as a clinical instructor in RPIIT College. Today we will discuss about the topic rickets. Rickets is the softening and weakening of the bones in children, usually because of an extreme and prolonged vitamin D deficiency. Vitamin D promotes the absorption of calcium and phosphorus from the gastrointestinal tract. A deficiency of vitamin D makes it difficult to maintain proper calcium and phosphorus level in bones, which can cause rickets. Adding vitamin D or calcium to the diet generally corrects the bone problems associated with rickets. When rickets are due to another underlying medical problem, need additional medications or other treatment. Some skeletal deformities caused by rickets may require corrective surgery. Causes lack of vitamin D. Children who do not get enough vitamin D from these two sources can develop deficiencies. Sunlight. The skin produces vitamin D when it's exposed to sunlight, but children in developed countries tend to spend less time outdoors. They are also more likely to use sunscreen, which blocks the rays that trigger the skin production of vitamin D. Food. Fish, oils, fatty fish, egg yolk contains vitamin D. Vitamin D also has been added to some foods such as milk, cereal, and some fruit juices. Problems with absorption. Some children are born with or develop medical conditions that affect the way their bodies absorb vitamin D. Some examples include celiac disease, inflammatory bowel disease, cystic fibrosis, kidney problem. Factors that can increase a child's risk of rickets include dark skin. Dark skin does not react as strongly to sunshine as does lighter skin, so it produces less vitamin D. Mother's vitamin D deficiency during pregnancy. A baby born to mother with severe vitamin D deficiencies can be born with the sign of rickets or develop them with a few months after birth. On northern latitudes, children who live in geographical locations where there is less sunshine are at higher risk of rickets. Premature birth. Babies born before their due dates are more likely to develop rickets. Medication. Certain type of anti-seizures medications and antiretroviral medications used to treat HIV infections appear to interfere with the body's ability to use vitamin D. Exclusive breastfeeding. Breast milk does not contain enough vitamin D to prevent rickets. Babies who are exclusively breastfed should receive vitamin D drops. Signs and symptoms. Signs and symptoms of rickets can include delayed growth, pain in the spine, pelvis, legs, muscle weakness. Because rickets softens the growth plates at the end of the child's bones, it causes skeletal deformities such as bowed leg, knock knees, thickened wrist, ankles, breast bone projection. Swollen ankle, swollen wrist, bowed legs. Complications. Left untreated, rickets can lead to failure to grow, abnormally curved spine, skeletal deformities, dental defects, seizures. Exposure to sunlight provides the best source of vitamin D during most seasons. 10 to 15 of the exposure to sun near midday is enough. However, dark-skinned or if it is winter or if the person live in northern latitudes might not be able to get enough vitamin D from sun exposure. In addition, because of skin cancer concern, infants and young children especially are warned to avoid direct sun or to always wear sunscreen and protective clothing. To prevent rickets, make sure that child eats food that contain vitamin D naturally. Fatty fish, fish oil, egg yolk or that have been fortified with vitamin D such as infant formula, cereal, bread, milk but not food made from milk such as yogurt and cheese, orange juice. Check labels to determine the vitamin D content of fortified foods. Intake of vitamin D supplements during pregnancies with doctor's advice because human milk contains only small amount of vitamin D. All breastfeed infants should receive 400 international units of oral vitamin D daily. Thank you. Please like and share this video and subscribe the YouTube channel of RPIIT Academics.